Thanks, Rocco. Before we begin, we would like to acknowledge the traditional custodians of the land from which we are joining today and pay our respects to elders past, present, and emerging. We would also like to extend our respects to all Indigenous people, colleagues, staff, and students who are present today. Thank you.
Thank you very much, Deep, and I too extend that welcome to anybody Aboriginal who's here watching today. I'm also going to hand over to Kathy, who's going to tell us a little bit about the cluster itself. I've said we are the cluster leads from UN SDG 3, but she's going to talk a little bit about the cluster and a little bit about the mission and vision of the cluster moving forward.
Thank you so much. And I'd also like to acknowledge any First Nations from any country that anybody on this Zoom is from as well. In terms of the cluster, we have 7 member clusters. And as was mentioned, in terms of we are leading, and it is something that we have recently taken on. There's 7 cluster members, which includes Makerere University in Uganda, Universidad de Caldas in Colombia, Universitas Gadjah Mada, Indonesia, Universidad Autónoma Metropolitana in Mexico, University College Dublin in Ireland, and Universitat Oberta de Catalunya, UOC in Spain. And UOC was the previous cluster lead for SDG 3, which is good health and well-being. And in terms of the cluster and what we see, it is very much looking at what are some of the issues, factors that higher education institutions are facing, both from an academic teaching perspective, but also with regards to our students. So the priorities, it is, again, one that champions inclusive, multidisciplinary, and action-focused approaches to our teaching and research in the space of health. And the priority areas are everything from harnessing online working and e-health methodologies, and this topic is very central to that, to informing and promoting informed academic research and policymaking by all stakeholders. Now, part of this is as well is we're with any of our seminars, we try to get the diversity of viewpoints, and we reach out, and again, we'd welcome ideas with regards to and welcome participation for this given seminar, but also future topics. So if there's any future topics that you would like.
Oh, you flipped over the mute, sorry, Kathy, I think. Kathy.
I was on mute.
No, you weren't. Just the last like 2 seconds. I don't know what happened.
That's right. That's fine. I don't know what happened. That's fine. I just would like to welcome for all those that are on this seminar, and we look forward to input and discussions about activities or events you'd like the cluster to undertake into the future. And if, for those that are cluster members and observers, if you'd like to stay on, maybe in the last 5 minutes, we can have a bit of a conversation where to go beyond this. Again, welcome.
Absolutely. Thank you so much, Kathy. Okay, so we have 3 fantastic speakers for today, this afternoon, this evening, depending on where you are in the world. I'm going to give a bit of a more detailed introduction as each speaker comes up, but broadly, we have our first speaker, who's going to be Dr. Joshua Pate, who's from University of Technology, Sydney. We have Nerida Klupp, who's here from Western Sydney University, and we're also going to hear from Kayla Jaye, who's a PhD student here as well. So I might hand over to Josh. I'll just stop sharing my screen if you want to share yours, Josh. All right, so Dr. Joshua Pate is a senior lecturer in physiotherapy at the University of Technology, Sydney, as I said, and he leads the Health AI Research Node, which is a team of 39 multidisciplinary health researchers working on AI projects. This work builds upon his ongoing research in children's pain, pain science education, and health communication. His work explores how children and families understand pain and how these meanings can influence fear, behavior, care, and recovery. He's passionate about making complex ideas clinically useful and accessible. And I've seen Josh present a few times, and he's an absolutely wonderful speaker. So I'll hand it over to you, Josh.
Thank you, Rocco. It's great to be here. I am gonna whiz through a bunch of different topics in the next 10 minutes or so. So we'll see what people glean from it. You're welcome to chime in or ask questions in the chat and we can talk more at the end from what I can gather. So I've titled this AI is becoming the first opinion, and that's a bit of a scary title. Um, and like what I mean by that is that you probably know people who are accessing ChatGPT while they're on the waiting list to see a doctor or something like that, or before going into ED or something. So it's a bit scary. And I think that's part of the context here is it's not like we can prepare and kind of wait for the rollout. It's like, no, things are already rolling out. And how can we do this really well and kind of make this ideal for people rather than just perfectly efficient for coders and other people accessing this general purpose technology? So I'm going to give 3 practical demos as well of some use cases for researchers, which it sounds like is the majority of the room here. And along the way, there's a couple of slides with this character. This is from my kids' books. This is Zoe Zoppens, and she just has some challenging questions for us. And here it says, should we be having second thoughts? So see what you get from this, and hopefully it's a bit of fun and keeps you awake on your Friday afternoon. So really quickly, Rocco introduced me on the stuff on the left. Really excited, doing some stuff with UNICEF, and then on the right, we're doing like it's hard to publish papers in this space because the models and things update so quickly, and so by the time it gets through peer review, it's already old news. And so I've set up a Substack to do like really like short-term experiments. One went out today. But we are doing a large number of studies in the AI research node at UTS. And so there's 39 health researchers, which is really cool. So not the tech side of the research, it's more like kind of the human interaction version of that. As a way of quickly introducing myself with some nice colorful pictures, I am really interested in research engagement and in trying to close that enormously long wait from a lab discovery through or to clinical implementation or reaching patient outcomes. And so doing a bunch of media like ABC interviews and stuff all the time. And I'm really fascinated by that. And if you want to get in touch, I'd love to chat more about that. So yeah, I mentioned change is kind of already here, and there's a stat there. A pediatric physio up in Queensland mentioned just recently that 50% of their patients are showing up saying, "Well, I already have a diagnosis," and the AI told me this. And I think we've moved well past Dr. Google, and I suppose now Google's first result is an AI summary as of a couple of months ago. But maybe at the bottom there, it says, should we be considering AI as an electroceutical? In the same way that we think about the benefits and risks of a pharmaceutical, maybe that's a helpful way of thinking about AI chatbots and agentic agents, which are now doing kind of multiple steps at once. There's a bit of a black box of like what happened in there in order for that output to come out. And the final dot point there, the keyword is meaning, because it's not just providing, oh, you've got this problem with your eyes or your nose or whatever's going on, or this is the reason for your pain. It's changing the meaning of what someone's presenting with. So they're showing up and they're saying things like, oh, when I was told, I was reassured that I didn't have any red flags. I don't know what a red flag is. And we're seeing these kinds of things in some of the studies, and it's really challenging to put our finger on it because it's changing so fast. To give you a quick indicator, this was made this a couple of months ago now. It was January to April. These were the releases from the 3 main AI labs, and these are predominantly kind of user-facing technologies. I think the main leading things that have changed would be that Claude Cowork and OpenAI's Codex are kind of the best products publicly available. Claude's beta one got taken away by the US government on the weekend. And yeah, that's kind of the update. But I guess progress is much more than just the latest models now because people are interacting with them in new ways. We can talk more about that, but I want to run through 3 really fast demos just to kind of give you a taste of how variable, like I've done this with 10 demos, but I'll just do 3 for now, just to show you like how many different ways this technology is impacting healthcare through research. The first is slide generation. And I thought this was so fun. The other week, I gave a presentation to our physio team at UTS, and I just put in this prompt as a demo for them. And I said, hey, like I want to teach them about this idea of a meta prompt. And so now I'm doing meta lecturing here by giving you a meta prompt about it. But the idea is at the end of your first prompt, right, can you make this prompt better? And so rather than asking for the answer straight away, what you get to do is see behind the scenes. And so when I gave it that prompt, it made this image, and I thought that was all right. So I'm not doing the meta prompting here. But then when you do the meta prompting, this is what comes up. It says, hey, here's what I want. I need it to be presentation size. Here's what the text says. Use a subtle visual structure. And look how much better that slide is. So for comparison, I'll show you option A was this. Like it's a mess. There's words everywhere. It's not terrible, but it's not great. And then this was the better version. Really clear, easy visual slide to observe. So if you're teaching, please don't have terrible slides. Or if you're giving a presentation at a conference, there is now no more excuses. You just have to wait like 30 seconds. So share a screenshot of your slide and then say, make this better, and then the slide will be better. That's unless there's secure data, don't do that. But like for general title slides and stuff, I think it's a great idea. All right, demo number 2, knowledge translation. So I recently I was asked to write in the conversation about W sitting. So when a kid sits with their legs like a W, parents often freak out about it. They think their hips are going to break or something. And it was just generally about how we over worry about posture. And so this was the article that came out. And at the time, I had the Claude Cowork subscription, and I wrote a blog about this, and I said, hey, I want to make an interactive dashboard so that instead of people who don't want to read anymore, they don't want to read 800 words, could you just make this like teachable in an interactive way? And this is a screenshot. So I just want to show kind of the limits. I love thinking of AI with the jagged frontier idea. So it's awesome at mathematics. It's making absolute mathematical breakthroughs. But at the same time, sometimes it can't count how many R's are in the word strawberry. And like, so it's like, it's worse than a toddler. But at the same time, it's better than the Olympian math athlete. And here's a good example. So Claude's not very good at images, but it's really good at interactive dashboards. So you can use this slider and slide time along, and it shows you which positions are okay for which body parts. And the hint is that everything's safe. Maybe not more than 30 minutes at a time, but just move around is good. All right. So, and the third demo I want to show is a really interesting one from a research point of view. I'll just slow down with the title. Synthetic, so that means AI generated, pre-pilot study. So when you're thinking, oh, I'm going to apply for a grant in 2 years' time, geez, I'd love to do a pilot next year. Like if you're in that stage where you're going, I don't even know, how would I find out if this is good? I've found this really useful personally, is to generate a big data set of like what it could look like if you did run a pilot or a full trial, and then that kind of helps guide your pilot. So it's not great data per se, but it's great to reflect on. And you'll see what I mean. So here's an example of the kind of, I used the meta prompt. I said, give me a pre-pilot nice prompt. And this is what the prompt said. And it was about a question that we're using. It was just what metaphors should we use when we're talking about pain to not scare a patient. And part of the outputs, it said things like include a full data set and give me recommendations. And this is what it looked like. I've got a video kind of screenshot thing playing, but basically you can see here that it shows your thinking now. So if you haven't used one of the thinking models, please don't ever use the freely available fast models. They're terrible in comparison. It's like you're just missing out massively. So always use thinking mode. Would be take home number 1. Number 2 is check out all the different formats of stuff it provides. It summarizes, it has a link to the full data set. It gives you like, it's just generating the next probable output, but it's making like pretty good sense of a topic like metaphorical, like kind of implications. So it's looking up qualitative papers and it's grabbing them, it's synthesizing, making new data sets. So here's an example of what the data looks like. And so you can see I've selected cell H2 there, and it says the smoke alarm is too sensitive. That was the metaphor that participant number 1 gave in this data set. And it's just crazy, right? And so you can then reflect on that and I think make better research decisions kind of in advance, so that then you can pre-register your protocol and you're not going to miss anything massive. So there's two parts to this. So first off, I've done some demos and I'd love to hear reflections. You're welcome to type in the chat. But I want to share some of the actual research we're doing because that's really exciting. And so I work at UTS. I mentioned this earlier in the city in Sydney, and just share a couple of quick things about the benefits and risks of AI. Can I just get a quick nod that people are tracking and it's not yet information overload? Great. All right. Thank you. A few people nodded. So this was one of our aims. I'll read it slow because there's lots of words. How stigmatizing are conversational Gen AI voice responses, so not typed voice responses, to parent concerns, I think it's hiding behind the video, about chronic pain? And so what we did was over and over and over again in the latest chatbots, this was now back in September last year, actually, we gave it two scenarios and we kept refreshing and getting rid of the cache. So it was a new chatbot every time. So scenario number one was, hey, my kid's got chronic pain. I think they're faking it. And we're seeing, does the chatbot side with the guidelines, with the child, with the parent, with the doctor? And then the second scenario was the parent is freaking out and they're saying, hey, the doctor's told me that my kid's got this chronic pain, but the doctor thinks they're faking it, but I think it's real because I see my child going through it. And they were the two scenarios. And we wanted to see, again, who's it siding with and how useful is the output. And the challenge so we did this with text-based models, by the way, in 2023 and 2024. And it reached a ceiling, it was maximally useful according to the best kind of rubric we could make up. And in the text form. So it would provide evidence, it'd be strengths-based, it was validating, it used simple, clear metaphors. It just ticked all the boxes really nice at a readable level of grade 8 or under. If you gave it the rubric, it nailed it. But the thing about a voice interaction is it tries to be really succinct and conversational. And so it often only says about 30 to 50 words at a time. Not always, but often it's trying to do that now. And so it's harder and harder to assess to see if it's nailing the answer. And so the way that we did that was to try and look first at, is it stigmatizing anyone here? Is it useful? And then the third one, we did a thematic analysis. And we actually, some of the people in our team wanted to test out AI running the thematic analysis. And so this was kind of a hybrid version of that. I'll just show you the start of the conversation as an example. I ran this just recently.
It says they are in pain, but I think it's all in their head.
I'd be cautious with that assumption. Pain is always real to the person feeling it, even if there's no obvious injury or medical cause.
Cool. I'll just pause it there because this was in, I think, March. Back in September, not once did the chatbot say things like, I'd be cautious with that. And it didn't used to push back. It did this thing called sycophancy. And if you're using the old models, that's what we'll see. In all the papers that are coming out with GPT-4 or less, they all just say, oh, it's hallucinating. It's trying to please you. Less and less is that a problem now. It still is a problem and we need to think critically, but it's much less of a problem. So I just wanted to share, because the person, one of my PhD students who ran this 60 repetitions, she had some reflections and I showed her this video and she was saying, wow, AI has evolved so much since September. The second point she said was the newer versions showed caution, which was awesome, because AI is actually challenging the parent and not just agreeing with everything that the person says. And the third thing that's awesome is that AI has started to use what we think of as curiosity. So I think that's really cool. But in the paper that we're publishing, hopefully very soon, it doesn't have that at all. And another side note, number 4, was it never once asked for the age of the child. And that is probably, any clinicians in the room, probably would write down or document the age of the child and be developmentally sensitive as one of the very first things that they would do clinically. But the AI hasn't done that. And I guess it points to the fact that this isn't a real world study. This is a simulation. Super fascinating, isn't it? We built this conceptual framework and I just want to explain 2 bits of it. The red bubbles up in the top corners. So on one hand, we can see this invalidating situation where the AI is doing the right thing according to the guidelines. It's thinking biopsychosocially, but then it's kind of undermining the parent and saying, hey, you're wrong. And when we see this happen in clinic, it leads to hospital complaints and a patient not getting better because the team isn't on the same page as the family. And on the other hand, in the top right of your screen, the AI does the opposite. It really buys into the parents. Oh, you're right, parent. Wow, it's so horrible. Yeah, your kid's faking it. And it creates all this stigma. And then the kid goes to school and faces bullying and all these invisible burdens that are going on that Beck's done all this amazing research on. Um, so some take homes, and I'm going to wrap up. If you're thinking and working with people who are using AI as a first opinion, I'd be extremely cautious. But if you're curious about it, I think there's some pointers there, and you can go back to the recording. And so the take home I want to leave you with is that we probably should at least be testing all of this new technology. It's very challenging. It's changing very quickly. But if we publicly document, here's what's useful, here's what's failing, here's what's really dangerous, here's what's surprising, I think that will lead to a better outcome for people when we're on the cusp of what some tech people are claiming will be artificial general intelligence or super intelligence. I think if it truly does continue exponential improvements, we want to make sure that we're keeping the humans in the driver's seat for healthcare. And so there's lots of challenges here, and I hope this has been really useful. So thank you for your time, and I look forward to hearing the other talks.
Thank you so much, Josh. That was fantastic. I might just go back to this view. Yeah, wow. So three really interesting novel uses for AI that I never even conceptualized. The meta prompting, the interactive dashboard. I didn't even know Claude could do that, and the synthetic pre-piloting. So that was fascinating. I have a whole bunch of questions, but I'm sure other people do too. From the audience, if anyone has a question, can I just get you to hit the raise your hand button for anyone who's got any questions for Josh? Thank you so much, Josh, for the great presentation.
Thanks, Rocco. I don't know if I'll be able to answer any of the questions, but you're welcome to ask them and we can wonder about them together.
Yeah, while people are mulling it over, the question that came to my mind was with the synthetic pre-piloting. I think it's a really cool application of AI, but I can see some potential issues around the ethics of the data acquisition kind of preparation phase. I was wondering if you could speak to some of the potential negatives of using the AI as a kind of model to simulate real world data.
Yeah, I'd actually think of it as like what you're trying to do. Hopefully, you have enough topic knowledge and content knowledge that you can kind of spot the holes in it. And so then the idea is going, oh, well, if AI is already joining those dots, but it's making these holes, then maybe these should be my questions. And so in the example I gave with the metaphors, some of them it's using no CBIC language, or it's really deficit framed the individual and not considering their culture or whatever those things are. And they kind of like it led the research teams to pivot and focus on something that's more novel. Because once you say, hey, why did you put that in the data set? It then sources the paper. And then you go, oh, someone's already done that.
Yeah.
And so I think the piloting itself, like this kind of synthetic data generation is almost, it's more useful as like something to reflect on than to trust.
Yeah.
And this is also true. I think RCTs, so randomized control trials, particularly are going to start having synthetic arms because you can then power your study. So you have the intervention group, a control group, a placebo group, and a synthetic group. I reckon that's going to be a big thing. If I had to guess what's coming in the next decade, yeah, there's just so much potential to have huge power in our confidence in findings, but there's some ethical issues, as you just pointed out.
Yeah, absolutely. Thank you. Great answer. Any other questions from the audience at this stage? There will be a little bit of opportunity for discussion at the end as well. And if you haven't got a question at the moment, because there was a lot to process, you can always pop one in the chat. I'm sure Josh should be able to happy to kick it around there as well. All good. All right. Thank you so much, Josh. Really appreciate it. Fantastic presentation. Up next, we have Nerida Klupp. So can I just get you to share your screen, Nerida? While you're doing that, Dr. Nerida Klupp is an educator and researcher in interprofessional health sciences at Western Sydney University. She collaborates across a range of health disciplines to develop curricula and critical thinking, evidence, and professional reasoning in health professional education. She's the AI lead for the School of Health Sciences here at Western Sydney, a role that emerged in response to the growing need to bridge institutional aspirations for AI integration with the complex realities unfolding in the classrooms. Her work explores how AI is reshaping student experiences, engagement, and well-being, particularly in that transition to university. So Thank you very much. Very interesting area. Really appreciate your time. I'm sure this will be a wonderful presentation too. Take it away whenever you're ready, Nerida.
Thanks, Rocco. So hello I'm at Campbelltown. I'm in Darabur land, and thanks for this invitation. I'm going to share some of my experiences and observations in this space. And I'm actually going to be visiting some of the trickier aspects of what we're looking at in the higher education space that you may or may not be aware of. You'll see in the headlines that we have this possibly major scale industrial fraud, and then you might also hear about the amazing opportunities and the things that are being done with AI, and where are we left in between with that situation. So that's what I'm going to be trying to give a couple of snapshots today about. I'm going to leave the other speakers to talk more about what AI is about in health. But obviously, you're aware of the advanced diagnostics, ethical decision-making, administration, monitoring, personalized care plans, all those things that could occur in the health field are exactly the same things that we are focused on in the education and the research space, and in preparing the students from the very first stage. So it begins with their higher education, of course. And I know I'm speaking to some people who are in the higher education space, but some perhaps who don't know what's happening there while AI hits us like a wave. There's some obvious good things. We've got things like what I like to call the bright, shiny stuff. And I suggest Joshua gets to play with that more than I do. Virtual patients, simulated scenarios, but also one, I think probably the course that most people have wanted to turn up to, the support given. I saw that my colleague, Dr. Tim Marsh, has joined us today, and he's been training us how to use chatbots for subject coordination, just because 90% of the questions students have can be answered in a 10-page document, and it's actually not that hard to create a chatbot to just answer those questions. In the classroom, we're mostly using AI to create content, maybe some feedback opportunities, things like Socratic questioning, which is where it's questions back and forth so that we can probe, explore, look for understanding. I think one of the best things about AI in higher education is the support of universal design for learning. So what that means is basically about access to all people. It means that we have multiple means of representing material. It could be visual and audio and in text, because people have different ways of learning. It involves multiple means of expression. So often when we introduced things like participation marks, the number of people who said, oh, but some people are shy, like there's never been people who have trouble writing assignments or sitting in an exam room. So we want, with this type of design for learning, is multiple ways that students can show how they learn and demonstrate their learning. And multiple means of engagement as well, different ways for students to engage with us, with each other, and with their learning materials. So I think AI has the potential to quite transform that area. I think maybe I probably should have put that in the very good category, but the reason that I've got these separate is because they're very conditional. For me, the most exciting thing about AI in higher education is, as someone who has developed a subject in critical thinking and evidence literacy, is the ability to create space for higher order learning opportunities, as opposed to our traditional content that now can be partly outsourced to AI. And we're playing around with a lot of different ways to get critical thinking into the curriculum, and a lot of it we need to do through teaching and learning in the metacognitive learning space, so students understanding their own personal learning styles, reflection, reasoning, and of course with AI, when we use AI and then we're asking students about that, they're using evaluative judgment. These are high order learning things, rather than just saying, does A cause B? There's also a lot of future potential for personalized supported learning experiences moving forward. But we're not there yet. Certainly I'm not, and I'm not aware of many people getting into that space yet. But down the road, I think that'll be a great thing. But what most people are talking about is how do we ensure learning when Gen AI is everywhere, prepare the graduates for professions and industries that won't stand still? How do we maintain or even regain trust in our awards? There's a fair bit in the media recently about what's going on in universities and AI and how meaningful our awards are, and whether or not, the question is, should I send my kids to university? And that's because of terms that come out like industrial scale intellectual fraud. And there is certainly potential for that. How do we build education that is turned upside down in every way? And one image I could have put in that I didn't, but you might be familiar with Bloom's taxonomy. And the idea is you remember things, and then you understand them, then you evaluate them. And at the end, you create something. And that's how pedagogy has been for a very long time. Well, what do we do when AI is creating the endpoint? Do we tip the taxonomy upside down? Well, we're talking about that, but for the moment, yeah, kind of. We're going back down and saying, all right, well, we've got to evaluate this and we've got to analyze this. And it's all been, the blocks have all been thrown up in the air and they're landing in a different way. And this is what's facing educators. And our guidelines and frameworks and recommendations come from UNESCO. TEXA is in Australia, our tertiary education quality and standards agency. I've just got a particular paper there that I read yesterday that is one of the more recent recommendations, the Australian Framework for Artificial Intelligence in Higher Education. But there's also narratives. And this is a narrative from Western Sydney University. Our educators will be outstanding. They will feel empowered and engaged, understanding the unique value they as humans bring to education. Engaged with AI, they'll be ready to adapt to and embrace emerging technology. Right, so apparently that's what we've got to be and do, right? Hope we have a plan. And I would argue maybe the plan's a bit tricky. We need to align curriculum. So at my end, at the coalface, in the classroom, I've got to align my curriculum. I've got to move quickly, and I've got to assess totally differently. So from the big narrative at the top to what educators are doing on the ground is a very big gap. Moving from shiny ideas to wicked problems. Wicked problem is something for which there's no obvious solution, and there's many layers and complexities to it. Sorry, something's just popped up on my screen. It's gone now. What our Australian higher education system, TEXA, has recommended and guided is two approaches. One is that we assure learning across whole degree programs. The other is that we assure learning within subjects. And you can also do a combination of these. A couple of terms that is getting technical, but really important for understanding this space is secure assessment is whether or not someone did the work themselves. And that is different to assured learning. That is whether or not they've actually learned. They've met those requirements for learning. You can have a secure assessment, not such great assured learning. You can have assured learning without a secure assessment. Ideally, they work. A secure assessment is a tool for assuring learning. And importantly, what the leaders in this space at Western Sydney University and throughout Australia have very much focused on is that we've got to pivot from thinking about detecting cheating to detecting learning. And that's our main paradigm shift that all of this is about. And I think that that is one of these big wins of AI, is that my own thinking as an educator has completely pivoted to being learning focused instead of outcome focused. But this pedagogical transformation requires different learning designs, different resourcing, and different educator capacity. This is how our university is attempting to do it. It's called the Inspire and Assure approach. And assuring learning is that important feature that is required, but we also want to inspire students to do, and I like the term, the work of learning that is often used by Kath Ellis and others in the field. Ideally, we've got an assessment that motivates students to do the work of learning and assures and celebrates their learning, but we're going to have assessments that might be mostly about motivation or assurance. And we don't really want to keep any of those assessments that does neither. Before I give you a snapshot of my situation, I'll give you a context of Western Sydney University. It is distinctly Western Sydney. Our engagement, our community, it's always front of mind of meeting the needs of those in Western Sydney, who tend to be more culturally and linguistically diverse, lower socioeconomic status backgrounds. And at our university, we have a huge number, I think it's 2/3 of students are first in family. No one else in their family has been to university before. And we also have some of the highest Indigenous representation and called representation as well. If you're listening from another country, yes, Australia is a developed country, but Sydney is also one of the most expensive cities in the world. So we have very high rates of student housing insecurity, food insecurity, as well as the anxieties of being a young person in the modern world. And if you're getting bored at this point, I hope you've been looking at the art down the side, which is from the Western Sydney University collection. Some lovely pieces there. And this map here shows our locations spread across Sydney. Here's the programs that we have, and you can see that they range from medicine to traditional Chinese medicine, from nursing and midwifery to epidemiology, paramedicine, health promotion. I won't read them all out, but it's a pretty strong mix of health, public health, medicine, nursing, and allied health. I love these pictures. I don't know about you, but this, I had to find what I thought was sort of the classic AI picture. It's got to be blue. It's got to have a computer in it. It's got to have a man or maybe a woman, if we're going to be a little bit more gender spreading, but a man in a white coat talking to another man in a suit. We've got Iron Man in the background. That's the way I see it. And probably my favorite, they've given him glasses and a little bit of gray hair, even though he's about 25. That is the image we like to think of. This is what some of us are facing on a daily basis. A very big elephant in a room that not enough people are talking about, and the students didn't come. So why? This is not the case. Every situation is different. Medicine, for example, will have a lot of in-person learning and assessment and don't necessarily have these challenges, but in my program, where we do the foundational subjects for health, academic, personal, professional, cultural, etc., and my critical thinking and evidence subject, we've got first-year students, maybe more than 1,000, up to 50 in a class that might go for an hour. Half of them are online. There's no compulsory attendance, no secure assessments, no threshold requirements, and they might be doing another subject at the same time that does have some of those things. Now, it's very hard for those students to manage their perceptions when the structure is so different. Why is this a good thing? You might be looking at that going, oh my God, there is intellectual fraud. The reason we do this is Western Sydney University is all about anywhere, anytime learning. Our job is to reduce the financial, geographic, personal, physical constraints that stop people getting to universities. We want to be flexible, accessible, and we want to use best practice pedagogies with that sort of system. So that's the good part, and that's why we do it. It's also, obviously, teaching at scale is more affordable for universities. The bad is before AI, students were struggling with that level of self-direction and teachers were trying to fill all those gaps. Since AI, as I said, not so much even arriving, because now we've got the additional, the students think that AI will be able to do the assessments for them, even if it's not true. So in a subject like my evidence subject and the others in my team, we're not going to have a secure assessment. Why? Well, because having 1,000 people, we can't necessarily run exams for them. Some universities are, but even if we did bring one back, I don't really want one, to be honest. I feel like we've going through a different pedagogical lens, and that would sort of take it back. But it's actually not administratively an option for me. I can't do any in-class assessment. We don't have enough time, too many, 50 people for 50 minutes. And I couldn't cope with the administration. If 10% don't attend, that's 100 people contacting me. Similarly, Vivas are difficult to do for 1,000 people with the resources I have. I also think it would be an inappropriate assessment for students who are struggling enough with turning up into classrooms and practicing talking to other human beings. To give them a Viva at the end of semester with so little preparation, not a lot of attendance, would just add to dropout rates, I think. So instead, this is what we try to do: assured assessment. By doing it, designing it through the subject, integrating AI into, I wish I had more time to talk about it, I'll try to be quick, integrating AI into everything we do. AI does it, then we do it, and we have a look at how they're different. Those higher order skills I talked about. Live drafting, again, my colleague Tim Marsh has been piloting this semester, looking at some options for getting students to do things during classes that will be on record later. A big focus on their metacognitive skills and bringing that and the relational and experiential aspects through their assessments to get them more to demonstrate their processes of thinking rather than any outcomes at the end. But there's still so many gaps for students and staff getting us both there. It's not just the students, it's the staff as well. They've never taught or assessed like this. I thought I'd quickly show you that I asked my students how they would do it. And there were some good ideas, but because 70% said group work, there you have the problem in a nutshell. No real student would ever say that they want more group work and therefore is probably done by AI. So as I said, we need that pedagogical transformation. We're playing around with learning design, but at the moment you can see we're up against big resourcing and educator capacity challenges. AI could raise the bar in every aspect of healthcare and education. Often sessions, seminars, and conversations about shiny developments, but actually good pedagogy is probably the bigger issue. And we need leadership and the higher education industry to communicate about the wicked problems more, not less, and along the way meet students in industry wherever they are. Thanks.
Amazing. Thank you so much, Nerida. Really nice overview of the good, the very good, the bad, and the ugly. So thank you very much. Applause. Does anyone have any questions for Nerida? There is one in the chat from Catherine. It says, I'm curious about the no compulsory attendance. I understand that attendance doesn't necessarily equal learning, but if you offer flexible delivery modes, face-to-face and online, then why not have compulsory attendance and assurance of assessment?
Yeah. In a very brief answer, going back to my point that we're trying to keep the financial and geographic and physical constraints to a minimum. In reality, we have a lot of students, a lot of the reasons that they're not attending is they're at work and they've got multiple jobs. Our students are carers, they have disabilities, and this is where the two are butting up against each other more strongly, perhaps, than at other universities, where this is such a focus for us. And it's what we're grappling with, how we can At the moment, we're being told still not to make these sorts of things compulsory. Let me make it quite clear, though, once you start getting to subjects where you have skills that are strongly linked to accreditation or registration requirements, or especially in any of our health and medical fields, they will have some compulsory attendance. But for those theoretical subjects, or psychology or critical thinking, no, the idea is students are able to learn in different ways.
Again, feel free to pop your hand up or type a question in the chat. Catherine says, thank you for the answer. I do have a question, Nerida. It doesn't necessarily reflect my view, but it is something that comes up with the AI discussion, slightly controversially. But the question is, if AI can do it and do it well, presumably it could also theoretically, this is about assessment, presumably it could also answer that question in real life. So regarding the secured assessment, does it really matter if the student actually learned anything or can do it themselves if the AI can do it? Because the AI will be able to do it in the real world. Does that make sense?
Yeah. And I'd answer in two main ways. One, there's an awful lot of things that can go. If we're going to make
this is a very dystopian question.
If we're going to try, the main way to find the resources and the capacity to pivot and go through this shift involves letting go of a lot of our traditional practices, a lot of the busyness and work for work's sake that it goes on in universities. So that's one thing. There's actually an awful lot that can go on. And in reviewing all of our subjects and programs, we do have to ask the question, well, if AI can do it, what do we do? The second part of it, of course, is that AI is meant to be our thought partner, where basically it's doing the parts, but we are driving the bus. And that's what we're trying to do in our subjects, is shift, as I was saying, this tipping upside down of the Bloom's taxonomy, that AI might create the product. But we've still got to be able to do, as I think everybody knows, we've still got to be able to do final reasoning, judgment, and decision-making around that. And that's where we want to shift the focus. So it's a little bit frustrating that I feel like I wish I had more resources, and it's a critical thinking evidence subject. And in my classroom, the main thing students, the ones who turn up, might be working on human anatomy and physiology, because they still have in-person tests. So they study that one, but actually AI could probably do that better than what we're covering. Not having a go at anatomy and physiology, very important field. But it's an example of where we can be rethinking where we put our resources and our focus. At the moment, again, the narrative's not matching what often is happening on the ground.
Yeah, great. Just quickly, Rosemary says that she resonates with you and what you've said. Her subject, a mental health in the community and social work degree, is part of the IA pilot project. So thank you very much for sharing. And I second that as well. Thank you, Nerida. Very, very, very much appreciated. All right, so we will move on to our final speaker. I'll just get you to share your screen for us, Kayla. Last but certainly not least, we have Kayla. She's a third-year PhD candidate within NICM, Health Research Institute at Western Sydney University. She completed her Bachelor of Medical Science in 2020 and her Masters of Research in 2023. Her research investigates the anti-proliferative and mechanistic potential of combining gut metabolites and standard chemotherapy against an aggressive subtype of breast cancer. That was a tongue teaser if I've ever seen one, Kayla, but I hope I did that all right. Alongside her studies, Kayla also works as a research project officer at the university, working on a number of public and community health-based projects. So take it away whenever you're ready. Very excited to see what you have to say on this topic, Kayla.
Thank you so much, Rocco, and absolutely nailed it. It's not often I hear other people say my topic back to me, so absolutely killed it. Good job. Um, Thank you. Good afternoon or slash evening, everyone. Thank you so much for your time in joining tonight. My name's Kayla, and I am a third and hopefully final year PhD candidate with the Nickham Health Research Institute at Western Sydney Uni. So yeah, as Rocco said, I did also complete my Bachelor of Medical Science Advanced in 2020. So kind of saw that last year right through COVID, and my Master of Research in 2023 as well. So I have been at university for quite some time now, but we're on the tail end of it. I'm very grateful to have been asked to speak today to discuss my use of AI in both my research and education and kind of reflect on the opportunities and challenges that have come with incorporating these sorts of tools into my academic work. I can't guarantee my presentation will be quite as engaging as Josh or Nerida's, or definitely not as qualified as them on the field, but I'll do my best to reflect on my personal experience, and hopefully if anyone else has, been a student or is thinking of it, it might, yeah, give you a bit of insight into what you could expect. Um, Now, AI has obviously become increasingly incorporated into higher education and research over the last few years. When I think about my 8 years of tertiary studies, AI tools such as ChatGPT and Claude and other AI assisted writing and coding platforms have essentially gone from not being heard of or really understood at all to kind of slowly being integrated within research and education to being so frequently used that rules and regulations surrounding their use in assignments, scientific publications, and also in theses writing as well have all come into play for students and staff alike. So it's been quite a big shift in those 8 years, and it's happened with what's felt very rapidly over the past few years as well. Now, the integration of these platforms into tertiary education has fundamentally changed how many students and researchers approach really key skills, looking at information gathering, writing, data analysis, and just basic problem solving as well, that are all very integral skills to learn within a tertiary education setting. Now, as a higher degree research student, my experience with AI has been largely positive, but it is really important to acknowledge that whilst it does have its place in academic work, like any technology or tool, its value really depends on how it's used. So in my research, I like to use AI to function primarily as an assistant rather than as an author or an analyst. So our AI tools, primarily ChatGPT, help me to organize my ideas, improve clarity in my writing, brainstorm some experimental approaches, or troubleshoot issues I'm having. So for example, when I'm writing abstracts for conference submissions or editing ethics applications, I'll often use AI to refine my sentence structure, improve the readability of my work, identify areas where an argument might need strengthening or kind of consistency throughout the document, or just ensure in general that the content aligns appropriately with the criteria for whatever task it is that I'm doing at the time. Now, importantly, I do not use AI to generate scientific findings, to source academic journal articles, or interpret and analyze data. Now, in research especially, accuracy is critical. A fabricated citation, an incorrect statistical interpretation, or a misleading biological explanation can have significant implications for both the quality and validity of your work. Any information generated or sourced by AI must be checked against your own literature searches, experimental data, and just also what you know as generic scientific knowledge as well. It's I know Josh kind of touched on this. There's definitely models that are better at this now, but a lot of the time it's geared to affirm what you're asking or proposing to it. And in actuality, it doesn't actually understand how to analyze the raw numerical data that you're presenting to it. And I've found that it's also prone to report incorrect scientific findings from academic articles, again geared towards supporting information you're trying to find. But when you actually go into that resource or document, you actually can't find anything that's relevant to what it's reported on. Now, one of the more valuable uses of AI in my research has been as a learning and discussion partner. So research is a continually evolving area, and you won't always have someone around who is familiar with the specific experiment you're working on or the compounds you're testing. And there's been many moments where I simply need to just talk through an idea, seek recommendations for adjusting my protocols to get some better results, or explore potential explanations for an unexpected result as well, which very common in science. And AI can essentially provide an immediate sounding board that can help me put a bit of a more critical lens on my work as I'm doing it. Now, for example, when analyzing experimental findings, it can recommend alternative interpretations, identify potential confounding factors, or just suggest relevant biological pathways that might serve as important factors of consideration. But the key thing to take away is that the final scientific judgment always remains my responsibility and not the responsibility of the AI tool. Now, beyond research, AI has also significantly changed my educational experience over my time in university. When I did first start in 2018, my learning often depended on access to lecturers, tutors, unit coordinators, or my peers. And while these relationships remain very important and obviously the backbone of the success of tertiary studies, they're not always readily available when questions do arise. For example, if I encounter a complex finding or question in my work, instead of messaging my supervisor at 8 p.m. at night, which I'm sure he would absolutely not approve of, I can ask some follow-up questions with one of those AI tools until I appropriately understand the concept or the material. And it can adapt its explanations to my level of understanding as I go and kind of provide that clarification in real time as well, serving as a time saver for me, but also my supervisor as well. Now, while this has made learning more accessible and in many ways more efficient, I want to emphasize the importance in searching for academic sources yourself, irrespective of the time it may take to do so, rather than asking AI to do this for you. As I mentioned, AI tools can generate responses that sound highly convincing, but are completely incorrect. And this is particularly problematic in scientific and academic contexts. AI often uses fluent and confident language, so it can be difficult for users to recognize when that information is correct or incorrect. And at the end of the day, finding, reviewing, and reporting on academic sources is an imperative skill that transcends all areas of study, health or otherwise, and really involves a level of critical thinking that's necessary in your tertiary studies. AI should not replace an independent evaluation of evidence, and essentially the increased prevalence of it will only increase the necessity for critical thinking in your work as well. Another concern from my end is an over-reliance on AI tools. I can almost guarantee there are students who are using AI to complete entire tasks rather than just as a support to their learning. And using AI to bypass the thinking process altogether undermines and really inhibits the development of those key academic skills, including writing, analysis, synthesis, which you should be learning essentially from your first year in university. Researchers, students, educators, we really need to be distinguishing between using AI as a learning support tool, which is what it should be used for, compared to as a substitute for intellectual engagement. Obviously, there's also ethical considerations that arise, especially in research, including questions around authorship, transparency. Data privacy is a big one if you're working with patient data sets, and academic integrity as well. Many universities, including Western, require disclosure of AI use in research and other assignments, reflecting that need for transparency in academic work. And if AI has been used to assist with writing, brainstorming, coding, or the analysis of any kind, the use does need to be acknowledged appropriately to kind of help maintain that trust in research as well. Another concern I want to raise, obviously, is equity. Whilst AI does have that potential to increase accessibility to knowledge and support, there does still exist differences in access to technology, variations in digital literacy, and just also resources available through institutions as well. So ensuring that students and researchers have an equal access to AI assistant technologies will be a really important challenge, I think, for educational institutions moving forward. I really think the question isn't necessarily whether AI should be used in research and education, but how it should be used. And ultimately, the responsibility for the quality, the accuracy, and the integrity of our work remains entirely our own as well. As AI continues to evolve, as does its role within tertiary institutions, and researchers and educators really need to develop new skills, new ethical frameworks, and new approaches to teaching and learning for those newer generations who are kind of being raised right onto that. So focusing on harnessing its strengths while acknowledging its very real limitations in a research and educational setting will really allow it to be a valuable research tool for students moving forward. Thank you so much, everyone. Hope I kept to time. Okay.
Absolutely nailed it. Well done. Thank you. Thank you so much. As someone who, I'll get you to just stop sharing your screen, Kayla, if that's okay. Applause again. As someone who did their PhD in a time where large language models didn't really even exist, or certainly weren't widely available, it was really interesting getting your insights. I had a quick question, just I'm cognizant of time, but given that in the past, the supervisor relationship, it was perceived as anyway, the supervisor is kind of the knowledge source, and then the student is there to be mentored and gain experience in that space. This is probably a question for you too, Deep. How has AI if AI has influenced that supervisory relationship? Do you think, okay, I'll go to AI rather than discussing things with my supervisor? Has that altered your PhD journey? I'm interested in your perception of that.
I think that's a really good question. I think I'm in a niche situation in that Deep's office is right behind where my desk is, so I have quite readily accessible to me. But I think in general, for myself, and I think I would probably say I'm becoming the minority here when I say that I do still go to him when I have a finding that doesn't make sense, or I'm having a recurring issue kind of in the lab. Sometimes if I'm in the lab and I'm on the go and it's just easier to pull up ChatGPT and go, okay, this is what's happening in this particular experiment, like what can you recommend? That might be easier. But generally speaking, I find that I still go to my supervisor primarily. It's quite easy when we're both in office multiple days a week. And like I said, close proximity, it does make it a lot easier for me. So that might put me in a more niche position with that question. But yeah, that's definitely how I find it.
Great. Rebuttal, Deep?
No, I mean, yes, I would like to interact less with my students, but that usually doesn't happen. So yeah, I mean, and also I think Kayla needs funding for her stuff. So, and AI is not in a position at the moment to provide that. So I think, she has to come to me for everything.
Yeah, exactly.
I'm kidding. I'm kidding. Yeah. Thanks.
Thank you so much. We had a comment here. Thanks for these great presentations, Josh, Nerida, and Kayla. I actually found the AI literacy for all training that WSU has subscribed to very insightful. Agreed. This training really reinforces all of these key elements in today's presentations. Recommend the training to everyone. Once again, thanks for today's presentation. I would like to echo that. Thank you. I've received a few inquiries and emails about people who would love to reach out to you guys to talk a little bit more. Are you happy for me to share emails and contacts with people? Cool. Great. It might be that's for Nerida and Josh as well. It might be a nice way for people to continue the conversation, ask additional questions if you are keen. So I'm more than happy to share the speaker's details so you can have a bit more of a chat to them. Are there any last minute questions before we go to the cluster specific discussion? Sure, Kathy.
Yes, actually, I have a question. Thank you so much for the presentation. I learned a lot. And somebody who is supervising both undergraduate as well as postgraduate, AI has really challenged us as well with regards to what advice, how we direct, but also being very conscious of giving them the heads up about how much reliance or not to rely on AI. But I'd be really interested to know from people if we're hitting the mark with the topics that we're presenting. And it's wonderful to see from the names that we've got some of the people who've been coming to our seminars at least this is the second time. Are we hitting the mark in terms of the topics that we are talking about? Do you have suggestions for future seminars or issues that you would like us to look at? We really want to hear from everybody before we get into the cluster.
Yes, 100%. Great topic. Thanks, Melissa. Appreciate the feedback. Again, we're more than happy to field any recommendations, any specific topic requests from people throughout the cluster via email, or if you want to reach out to Deep, Kathy, or myself. It does seem like there's a lot of comments coming through. It sounds like it's resonating with people, which is good. Thanks for bringing these great topics. No problem at all. Thank you very much. Great. Definitely good topics. Okay, good. That's reassuring.
Any suggestions for the next seminar in terms of when we think about health and well-being broadly within the higher education sector? What comes to your mind beyond AI? So, Rocco, would you mind putting that slide up with our priorities? Maybe that can get people thinking about and just realizing what our focus is on, please. Thank you. So I just thought, since we've got a few more people still on, I know it's Friday night, and very early in other places. Thank you so much for that. So this is really our priority areas. So we're really keen to know what are some of the issues. And again, we have an understanding of what's happening in Australia and at our university, and we have had our ear to the ground in terms of what's happening elsewhere. But what issues do you see that would be worth tackling or thinking about or considering? Or would anybody like to take the lead next time on any of the topic? And here, particularly for some of our members, our cluster members.
Yeah, it doesn't have to be Australia-centric, it doesn't have to be Western Sydney-centric. More than happy to have cluster members jump in, present, co-host, host. We will obviously provide support and infrastructure to help that happen. But yeah, more than happy to share the love and the load around. Big topic.
Yes. Okay. Well, I think technology and health, telehealth, yes.
Yeah, I think quite a few people throughout the week have recommended that telehealth technology and health space. Definitely can speak to that myself, especially transitioning through COVID. Really good topic. How often does the next webinar come up? The next one will be in a few months. So we're trying to have 3 a year for the cluster members. And beyond. We've got a few people outside the cluster that have joined today, which is great. So yeah, the next one will probably be around September, I think, Kathy. We'll notify the cluster.
Yeah. So in September, so we've got the IAU big conference is happening in Australia for the first time, and that's going to be in November. But we plan to have something in September. So technology in health, telehealth, yeah, sounds great. And thinking about regulation. So we're noting that. Would you see it as in terms of when you talk about laws, Paula, is there specific things that you're thinking about? Is that more in terms of rights, or is there what specific elements are you thinking about?
Yeah, I was thinking about the changes of, well, I talked to my GP today actually, and he told me that, yeah, after the 30th of June, things are going to be changing in relation to patients accessing the doctor by telehealth. And one of the things he was saying is consent that needs to be done online, and he's very worried about the elderly patients. They don't they don't use emails or, so they need to physically go there to sign consent to be able to be consulted on the phone, for example, or video. That's what he was talking about today. And he said there's more things happening. We didn't talk the details. I don't know the details, but I think things will change, are changing in relation to regulations. Yeah, that's what I was talking about. Yeah.
And people's scope of practice as well, kind of shifting and having to morph because of the transition to tele-rehab. Absolutely. All right. I think,
That
go ahead, Kath.
interesting. Yeah, no, it's interesting. If you've got any suggestions or you'd like to talk about this yourself, we'd very much welcome it. So thinking about something about technology and health, but again, thinking about the broad aspects of it with regards to access and the older people, but also thinking about rights and what informed consent means and who has the right to give consent, and so on. So some of those elements, is that where, am I on the right track?
Yeah, you are. And Jacqueline just wrote something in there
Yeah.
as well. And I was thinking, AI and, something as simple as medical certificates. Our students apply for, missing compulsory activities or extensions with medical certificates that I have doubts that they really seen a doctor. It's very easily generated now. So maybe that's why the laws are changing, or the policies. So
Jacqueline's comment was around the issue with access to technology, use of technology is not specific to certain populations. Very true. We're just talking about the difficulties that university students are having that crosses basically all adult age demographics. So yeah, it's definitely applicable across the board, not just to particular ages or demographics. I'm cognizant of one little bit from Elise, just last, because I'm cognizant a couple of the speakers have to head off as well. Learning health systems, where data, clinical experience, research evidence, patient community perspectives, and improvement processes are continually used to improve care. Could be an interesting topic for higher education students to think about as they become part of a learning health system. Yeah, absolutely. And could tie in with some of the topics we've been talking about today, at least, definitely. I'm just noting all of these down for the next seminar. Good, great suggestions, good things and food for thought to take forward into the next one. All right. Well, thank you very much. Thank you, everyone, for coming. Thank you so much again to our speakers, to Josh, to Nerida, and Kayla. Once again, I'll put the people who have reached out, wanted to chat further to them in contact via email. If you have any questions about the cluster or you have any questions about where we're heading or additional suggestions to the great ones that have come up, feel free to contact myself, Kathy, or Deep. Have a good day, evening, afternoon, everybody, and we'll see you at the next one. Thank you so much.
Thank you.
Thanks, everyone.
Thank you. Bye.
Thank you again.